I'm Dr. Maeve Kenningham from Dr. K's clinic. This is just a little face map that will help me describe what it is that I'm processing when I look at your face. So first of all, what I look at is what is the shape of the face? Is it a feminine shape, which is like the inverted V, or is it a masculine shape? And sometimes when women age, they become more masculine looking because they tend to have a squarer face because of the descent of the soft tissues. Is there any asymmetry in the face? So I look at, well, actually, does the right equal the left? I'm not expecting it to, but are there particular asymmetries that may need addressing? What does the face tell me emotionally? Does the face look sad? And for example, the face often looks sad if there is a downturn of the mouth and the marionette lines are quite pronounced, and a downward droop of the eyes and maybe the eyebrows. Sometimes people can look anxious or angry, and that's when there is etching between the brows or there's pinched lips. And actually, just dealing with that feature may be all that is needed to brighten the face or to actually allow the patient to emit their emotion more accurately. Then I have a look sort of from the top right through to the bottom as to where is there any volume loss that has occurred over time, and that's the skeletal changes that has happened with aging, or is there deep fat pads that have been lost. And just watch how the face moves in animation. So for example, I may be looking at, is there forehead lines, is there frown lines between the brows, is there a lot of hollowing out of the temples? And this happens often with age. I see quite elderly ladies have a very hollow temple, and is that aging? Hollow temples often don't come on their own. They often cause a downward droop of the eyebrow and sometimes sagging of skin. The middle third of the face, it primarily looks around the eyes. Is there a deep shadowing under the eyes? Is there darkness, pigmentation under the eyes that makes the patient look tired? What is the deep fat pads? Are they intact? These are fat pads that are there in our youth and gradually deplete over age, no matter what our weight is doing. And this may give a sort of sagging of the area above because there's no sort of buttress to hold fat pads that support under the eye. So they may look bulgy or may look sunken. The cheek itself may look sunken. There may be quite marked lines. That in itself isn't particularly aging. However, if they start to traverse down the cheek, well, that can look quite aging. Also look at the nose, and at this stage I may even take a side view of the nose and have a look. Well, actually, is the nose, has it got a nice line to it? Is it congruent to the rest of the face? And if that's a concern, I can adapt that with fillers. I may notice that there's hollowing in the cheeks, and again, just like with the temples, we are programmed to lose fat in our deep fat pads. In this particularly the case in the outer aspect of the face, so there may be hollowed out temples and hollowing underneath the malar arch, which is this cheekbone. And then I look at the lower third of the face. So again, it's mostly in the middle here that shows the most signs of aging. So are there nasolabial lines? How etched in are there? Has the nose splayed a little with aging, and the aperture, the hole as it were, becomes wider as we age? That can often lead to a splaying or a widening of the nose. and there's clever tricks that I can use to reduce that appearance with fillers mostly. Also have a look here, is there lengthening of the top white of the lip, and that can be quite an aging sign. Again, I use a mixture of toxin and filler to adjust for that. Is there pinching of the lips, as these little lines that cross over into the lip? Are they present? Is there a downturned mouth, which can be adjusted really with a little bit of toxin or with filler? This little crease that occurs here. Now that occurs for a number of reasons, because when we age our chin actually shortens, and then the bunching of the muscles as a result creates a line here. Are there marked marionettes? And the worst thing to do in this case would be to, there's a line, we've got to fill within this area, because that unfortunately can make a very feminine face look very masculine as it begins to get square and heavy. One must look at the outer aspects of the face, because often there is lost volume in the outer aspects of the face, and if that lost volume is replaced, then one can get more of a lift and less of a sag at the front of the face. So it means therefore that one needs less fillers, less biostimulators, more clever use of toxin in order to reduce that lined appearance. And a common complaint that people approach me for, because they don't like the jowling that happens here. Now these are often as a result of what's gone on higher up or back here, but also to do with skin laxity, which brings me on to the next thing that I look at, but I'll talk about that in a moment. So sometimes this jowling, it needs maybe a mixture of volumizing, maybe some threads like PDO threads, maybe a little bit of filling, maybe a little bit of use of toxin, maybe a little bit of use of, for example, jawline filler, and even fat reduction if there is some heaviness in this area, the submental area, and I address that with a product called Aqualyx. Last of all, as we're zooming in on the face, one then looks at, well, what is the condition and quality of the skin? Because sometimes just addressing that can be enough to make the face look fresher, healthier, and I think it is often overlooked, and it's an incredibly cheap way of getting a global restoration or a global effect, freshening of the skin, and there are particular products that I would use for example, dullness, oily skin, lost elasticity of the skin, loss, there's increased pigment, sun damage. So I often like to sandwich skincare in between 2 to 4 in-clinic peeling sessions. That sums up what I do when you come to see me for a skin assessment. If you want to begin to see me or speak to me on the telephone, if you go along to my website in the contact me page, you can schedule a telephone consultation or a face-to-face consultation and ask me whatever you need. Okay, I hope to see you soon. Bye now.